All right, coming to this now, healthcare facilities and hospitals, especially in Gauteng, urgently need a shot in the arm when it comes to infrastructure. Several hospitals in the province badly need repairs and maintenance. Doctors and medical staff have highlighted their constant battles with crumbling infrastructure. Nehawu Secretary General Zola Saphetha now speaks to us about this. And Zola, thank you so much for your time this morning. I mean, when you look at the dilapidating infrastructure in the country, how do we get here? It's gotten to a point where it's also affecting the work of our frontline workers in our medical fraternity. I mean, when we're looking at doctors, the conditions they work under in some of these public hospitals, it's just unacceptable.
Good morning to you, Tumelo, and the viewers. Yes, indeed. You know, a country that does not value the health of its citizens deserves no future. And that's what really we're experiencing in South Africa, precisely because of the neoliberal policy that government relies on, which in the main is more about austerities, which largely are more about cutting on the expenditure and the spending, particularly for matters of social development.
With that being said, Zola, what do you think then needs to be done at this point? How urgent is infrastructure development? And the question that everyone keeps asking is, where do we even begin and how much time then will it take to recover?
Look, we have lost hope to our government precisely because this is a government who refuses to listen. Because we do think that, firstly, health should not be regarded as a wasteful expenditure. Rather, the country must invest in health because that's how you sustain your population. But this is a government that is confined narrowly on cutting in favor of their own self-accumulation out of the state resources. So the first thing is that we have to deal with the logic of government, but also deal with the real orientation of our politicians that are at the helm of the state to appreciate that everything else is about society. Therefore, if they place society, we can then have a better look in terms of the condition of our people, but more in particular for the condition of healthcare practitioners, and both at the level of clinical and non-clinical, because that's where the service is so critical.
Have you tried engaging government on this matter and perhaps even expressing some of the concerns that have been lamented already by healthcare professionals?
There is no time that we have engaged government other than the COVID-19 period. As you would remember, we have been at loggerheads with them. We have even conducted fact findings, and where we pointed on those issues of infrastructure, because they've had a very negative impact to the conditions that workers are subjected to, because in the hospitals, lifts are not working. There's nothing that is working. Generally, the infrastructure is limited, so there's nothing really. And we have been putting measures, and we're also saying to the leadership of this government that move away from the wasteful logic in terms of health, put health as an investment. But unfortunately, with those engagement, they've landed to a deaf ears.
And what's been their response to you, Zola? I mean, what's been their commitment so far? Surely your concerns and your grievances being raised cannot land on deaf ears. Surely there is an urgency that government has committed to acting upon.
You see, if you ask it at the level of the Department of Health, they are pointing fingers to Treasury, and Treasury, they are pointing fingers to the economy, despite the high level of borrowing and the price hikes, and the fact that they've been cutting even the personnel at the hospital. Since 2015, there have never been employment of doctors and nurses because people are saying that they're saving money. As a result, the health care system collapses now in their hands. So also it's more about promises. You remember that the ANC won our votes in 2019 on the basis that they will employ in the period 50,000 healthcare workers, and only 18,500 have been employed. And when we engage, we are told that there's no money, so there's nothing that they can do, despite the need of that kind of a service to intervene to the societal challenges that we're faced with now.
On the point that you're making around the employment of more nurses and more doctors, while that already is a call for concern because we need more doctors, we need more nurses, and it seems the pace at which the procurement and recruitment, rather, is the word I'm looking for, the recruitment of those services is slow. Aren't we also seeing another concern, Zola, where we're also losing doctors who are saying they cannot continue to work under such conditions? When you're looking at public hospitals in the country, doctors saying they cannot work in infrastructure that not only is a danger to their own lives, but continues to be a danger to patients.
Yes, because they are held liable, responsible for any death that might occur as a result of lack of infrastructure that is needed at the hospital, and they are blamed, and their certificates have been withdrawn. They are being victimized generally. As you know now, that government is refusing even to compensate public service according to the CPI. As we know that people are going to be paid 3% despite the level of CPI now. So workers generally are suffocating, yet they are working. So as they wake up every day going to work, there's nothing really in return that they can point to that. And they are subjected to these conditions. You know, when you are to be serving a patient, for instance, at floor 7 in the hospital, you have to take stairs.
We have to leave it there on that
Just
note.
to go
Thank
and
you
see
for...
that thing, because lifts are not working.
I think it's because of your network there. You're trying to complete your point there, but definitely point taken. Now, Secretary General Zola Saphetha narrating the conditions with which medical doctors have to find themselves in most of our public hospitals in South Africa and in Gauteng due to the lack of infrastructure, maintenance and development. Of course, doctors in turn being held accountable for lives lost. They're saying that their own lives and the lives of patients with the infrastructure they're working under is simply, of course, unacceptable, and it's dangerous.